Hello, good afternoon. I've already been introduced, and my topic is a nurse's perspective on healthcare access for individuals experiencing migration. Am I doing the right thing? Okay, nothing to disclose. So as introduction, I thought I would talk about what it is all about, what migration is all about. So everyone who is living outside their countries, sorry. Shall I do this? Everyone living outside their country of birth is considered as a migrant. People migrate for different reasons, mostly because of war and work or studies. And access to healthcare is a basic right for these people to enjoy. Restricted access can have impact on their mental or physical health, and migrants depend upon healthcare to rebuild their lives. Unfortunately, too often they face barriers to accessing even the basic health services. In all the 4 nations of the United Kingdom, refugees and asylum seekers with an active application or appeal are fully entitled to free NHS care. The situation for refusal asylum seekers is not the same across the nations. That's where the issue is. So there are many reasons of failing to access the healthcare. And one of the main things is lack of understanding of how the UK healthcare system operates. So many people come into this country, they don't know how to go about to the hospital, the difference between hospital or GP, and they don't know what to do. Most of these are the refused migrants and who may be even afraid of asking about these issues. I've got a case study of MM who migrated to this country and was in a migration hotel. She came to our clinic and was started on medication because she had been diagnosed back home. However, just as we were trying to get information about her, she was relocated to a different place. And she had no knowledge. Just imagine from Crawley into London, and there's no way she understood about the London. We tried to let her know the nearest clinic to her, but she couldn't understand. Later, she was transferred again to a location B, and then C and D. And these movements, 4 movements, occurred in 6 months. And she was always pleading with us. We were the first people that saw her. And you can imagine, sometimes we need to imagine if we were the ones. If you were to go maybe to Zimbabwe today, and you have got all these issues, it's so difficult. Sometimes you would be heartbroken by the way these patients plead for them, for you to help them. But unfortunately, even when you try to explain to them, they don't understand the logistics, the system in this country. And some of these people are so afraid. They are afraid of the risk, especially those that are undocumented or those that have been refused. They are afraid of the risk to be reported to Home Office. So they would rather stay home. They are afraid of the risk of detention and deportation, for so many of their friends or relatives have been deported. The data sharing between NHS and Home Office, and this may frighten them. That's just the imagination that if they go to hospital, the hospital and Home Office may also share the information and they may be seen and deported. There's an example of a lady who was diagnosed late, not because she wasn't in the United Kingdom. She had lived in the United Kingdom for 10 years, but she was afraid to go to a GP even when she felt unwell. She couldn't even come to hospital. It was only when she had been diagnosed, when she was very critically ill, that she went into the ITU. On further questioning, I realized that this patient, there was a time that she had a severe toothache. She says she extracted it on her own. She pulled it out because she was afraid to go to hospital. You know, sometimes when you hear these stories, they appear like they are just stories, but these are really lived experiences. And the other thing is language barrier. You know, sometimes they think we do not understand them. You know, in Crawley, we live in an area where there is an airport, where there are 2 detention centers and several hotels that house the migrant people. And so many times they feel that they are not understood. And they are afraid that, you know, even the interpreters themselves may also report them. We've got a 19-year-old girl who came from another country through another country. And when she was in country B, she was sexually assaulted by multiple assailants, physically banned for refusing this. And up to today, I saw her 2 days ago. She says taking HIV, because she was diagnosed in this country, taking HIV reminds her of the abuses that she had. And she doesn't want to see any men. She's afraid of even the interpreters. We no longer use interpreters because she thinks if they know her language, she might be recognized. And so it's just such a traumatic experience. So the language, how we have done with her, now we are doing Google Translate, but sometimes, you know, with Google Translate, you can mix the actual things that you want to ask. You might not understand each other, but for now, this is what we are doing. She has declined to be referred to peer mentorship. She has declined to go to psychology, and I'm just about to refer her to Chiva, and I hope Chiva will help, because Chiva has helped one of our young men, and I hope she will also be helped. Housing is another issue. For those that are housed in hotels or those that are legal, it's okay. But for those that will share with housemates, there is a possibility of their tablets being seen and Googled, and we have got stories of people that had their tablets Googled, and people realized that they were on ARVs, and this made them to be rejected or to be evicted because of the little knowledge that people had. And sometimes they also, this prevents them from coming for their reviews. And the housing situation mostly affects the IV drug users in Crawley, where I am, and most of the time they are homeless. And when they are homeless, they are difficult to follow up. And they end up sofa safing in friends and relatives. And in those situations, they cannot take freely their medication, and they cannot say that they are HIV positive. So they cannot come for their treatment. And we find that not even in the HIV, but also even to the GPs and other services. Stigma is one of the issues, especially when somebody has HIV and is LGBTQI. I've got a trans non-binary that have language barrier. They came from another country and they cannot speak not a bit of English. It's such a difficult to speak to them. And they were in the migration removal center when we saw them. When they came, they, because we use Google Translate most of the times, because what you call the interpreter, sometimes we will be cut in the middle of speaking. And so many times we have used the translators, and then we'll use Google Translate. And we have found that this, they were stigmatized due to what they are. And in 2 different places, because they are moved, these people are moved from place to place. In 2 different places, they were assaulted for who they are. And they moved from one place to another and not being able to access healthcare. Remember, they are being stigmatized. Remember, they cannot speak English, and they don't understand about the services that are available for them. For this particular one, she was also under crack cocaine with mental health issues and very terrified and traumatized after having been assaulted. They would phone and say, please help me, please help me. But then they are in another place where we cannot help them. But this is the reality of these people, what they are living on a daily basis. And the essential services, some of the essential services are being chargeable. For example, hepatitis C treatment. I've got a TZ who received a 2,000 bill for hepatitis C treatment from overseas visitors' office. We appealed and they understood, but this patient has stopped coming to the clinic because they think they are going to be detained, they're going to be deported, and this has created a lot of problems. As you can see, they are co-infected, not only with hepatitis C, but with TB and other issues. And now they're no longer coming to the clinic. We're doing the best that we can, but this is the real situation. The question is, so what? Maybe we need free specialist services and information to be given to the migrants on healthcare system in their own language, friendly migration system, people not removed unnecessarily. I've got a consultant who is an advocate for patients. She has written letters and letters about patients not being moved from A, B, C, D. But you know, these people, they've got their own power. Sometimes patients are just moved in the night. The following day, we hear that they have been moved. I wish every one of us could understand about these issues. Thank you very much.